Yeah. Namaskar. As today is we gathered here on the occasion of Doctors' Day, and in this Doctors' Day webinar, we have topic today: role of doctors in global health initiatives, strengthening healthcare for all. So, is on the occasion of Doctors' Day, myself, Dr. Anil Kumar, Director SCFI, on behalf of Dr. KK SCFI, welcome our both the speakers, Dr. Nishinath Jha, who is a senior consultant physician, Fortis Hospital, Shalimar Bagh, and General Secretary, North Delhi Physician Forum. Namaskar, Dr. Sahab. And Dr. Ellen Gupta, Professor and HOD, Ashok Medical College, Faridabad, and ex-professor and HOD Neurosurgery, ABB MS, Dr. RML Hospital, New Delhi. We welcome both our speakers, Dr. Jha and Dr. Gupta. I also welcome the moderator of the program, Dr. Mr. Rekha Anil Kumar, Madam, from the Faculty College of Nursing, Dr. RML Hospital. Dr. Rekha, Madam, I know associated with this Dr. KKSFI for so many years, and particularly during the COVID-19 pandemic with Dr. KK Agarwal, sir. She was one of the active pillar for the Dr. KK SCFI. Namaskar, madam. I also welcome our co-host, Professor Dr. Manju Chugani, madam, Dean School of Nursing Sciences and Allied Health, Jamia Hamdard. Namaskar, madam. And also welcome Dr. Geeta Parvanda, Principal and Dean, Panna Dharma Subharti Nursing College, Swami Vivekanand Subharti University, Meerut. Namaskar. Well, I also welcome Dr. Archana Chaudhary, Principal School of Nursing, Tirath Ram Shah Hospital. Namaskar. I also welcome Dr. Manisha Gupta, Principal, Rabindranath Tagore University. Namaskar. And Mrs. Sakshi Singh, Assistant Professor, Holy Family College of Nursing. So, on behalf of entire Dr. KK SCFI family, I welcome our both the speakers, moderator, co-host, and all the participants from all different sectors, particularly the medical field and doctor this family. That is. I just give some background of the Dr. KK SCFI Heart Care Foundation of India. Most of you present here, you know about the Heart Care Foundation of India. That is Dr. KK SCFI. और डॉक्टर KK अग्रवाल सर के विषय में बताने की शायद किसी को जरूरत नहीं है कि जो उन्होंने किया है वो मेरी नॉलेज में हो सकता है और कोई हो, मेरी नॉलेज में कोई ऐसा नहीं है कि जो उनका कंट्रीब्यूशन पर्टिकुलरली जो पब्लिक हेल्थ और मेडिकल फील्ड में और एनवायरमेंट फील्ड में रहा हो। तो ऑल टुगेदर तो उनको आज इस ओकेजन पर जहां भी होंगे हमारा एंटायर SCFI फैमिली और आप सबकी तरफ से उनको नमन, उनकी ब्लेसिंग हमारे ऊपर हमेशा रहती है और आज भी रहेंगी। The Heart Care Foundation of India is basically a leading national non-government organization, NGO, working since 1986 in the field of creating mass awareness on health and environment among people for all walks of life and providing solution for India everyday healthcare needs. Basically, SCFI uses consumer-based entertainment models to impart health education and creating mass awareness among the people. And it is a very innovative way and different in the normal awareness. This is the basically a new model of the entertainment model. A leading example of this is a Perfect Health Mela. We all know, all we have participated from so many years. The Perfect Health Mela, basically an annual event, started in the year 1993. And that witnesses a physical attendance of over 1 lakh people and digital attendance of over 10 lakhs each year. And that was the remarkable achievement of this Perfect Health Mela. The Perfect Health, even the COVID-19 pandemic also, we continued this, the efforts of that Dr. K.K. Agrawal sir initiated in 1993. And मेरा सौभाग्य रहा कि मैं 99 से डॉक्टर के अग्रवाल सर के साथ एसोसिएट हुआ था जब मैं दिल्ली गवर्नमेंट में था, और तब से मैं एनवायरनमेंट में, उसके बाद डायरेक्टर रहा 10 साल दिल्ली गवर्नमेंट में एनवायरनमेंट में। तो उनके साथ, और मेरा सौभाग्य रहा कि उस पीरियड में भी उनके साथ बहुत बड़ा मेरा एसोसिएशन रहा उनके साथ परफेक्ट हेल्थ मेला में और प्रोग्राम में, जब IMA के प्रेसिडेंट भी थे वो, और उनके साथ जो 3 साल उसमें भी हम बहुत एसोसिएट रहे। और उसके बाद फ्रॉम लास्ट 4 इयर्स, और उनके साथ उन्होंने मुझे अपने साथ एसोसिएट किया आफ्टर दी फ्रॉम दी लिविंग फ्रॉम दिल्ली गवर्नमेंट। और आज मैं उन्हीं की ब्लेसिंग से आप सबके बीच में जो भी थोड़ा बहुत कंट्रीब्यूशन कर पा रहा हूँ, तो उनके लिए मेरा बार-बार नमन है। नमस्कार। और जो परफेक्ट हेल्थ मेला है, दैट वाज दी बेसिक शोकेसेस एक्टिविटी across different categories such as health education, seminar, checkups, entertainment programs, lifestyle exhibition, lecture, workshop, competitions. So many ways that the Perfect Health Mela continued. In addition, the SCFI also conducts program and camps to train people on the technique of hands-on CPR through its CPR 10 mantra for revival after a sudden cardiac arrest जो है। डॉक्टर के अग्रवाल का जो फार्मूला था कि मरने के 10 मिनट के अंदर, मतलब 10 का जो मंत्र था उनका, 10 जो है, अर्लियर इज द बेटर। तो ये कॉन्सेप्ट लेके उनका एक जो उनका स्लोगन था, वो आज भी सब लोग जो है, और उसी स्पिरिट से आज भी वो CPR ट्रेनिंग कंटिन्यूड है। SCFI currently holds 3 Limca Book of World Record for the maximum number of people trained and hands-on only जो है CPR in one go. That was the 3 Limca Book World Record. That was. और SCFI has a project called Heart Care Foundation Fund to ensure that no one dies of a heart disease just because they cannot afford treatment. और COVID-19 में तो उनका बहुत एक स्लोगन था कि किसको भी जो भी अब लेक्चर्स उनके सुबह 7-8 बजे से लेक्चर शुरू होते थे, रात में 9-10 बजे तक, तो उनका एक ही कहना था, जिसको भी बड़ी सांत्वना होती है, मैं हूं ना। तो वो उनके एक मैं हूं ना से ही हमको बहुत जो है मिलता था कि वो हमारे लिए बैठे हैं। और उन्होंने कितने ही, नॉट ओनली कि जनरल जो पार्टिसिपेंट होते थे, कितने ही डॉक्टर्स को जो उनसे जो है ये ट्रेनिंग लेकर के, और कितने लोगों को उन्होंने ट्रीटमेंट किया कोविड-19 पैंडेमिक में, और कितने लोगों की जान बचाई। तो ये मेरा खुद अपना अनुभव है कि मैं बहुत से लोगों से मिला जो कि मतलब एक हमारे रिलेटिव भी थे, जो कि स्टार्टिंग में ही उन्होंने मेडिकल फील्ड में एंटर हुए थे, और उनको सर से जो है उनकी ट्रेनिंग लेकर के ऑनलाइन, और उन्होंने कितने लोगों की जो जान बचाई। और उनका ये भी कहना था कि इस ट्रीटमेंट में ऐसा होना चाहिए, ना कोई बिके ना कोई मरे। दैट वाज द फार्मूला, कि इतना भी कॉस्ट ना हो कि उसका जो है, जो उसकी एसेट है या उसकी जो भी है वो बिके और ना कोई मरे। तो इस फार्मूले से उन्होंने सबकी, लाखों लोगों की जान बचाई। SCFI has actively involved in education, not only masses but also doctors in India and around in 19 countries of Asia and Oceania, including Australia, New Zealand. जो आपका समारोह वगैरह की आप मीटिंग देखते रहे हैं, उनमें उन्होंने कितना कंट्रीब्यूशन किया। These efforts gained unprecedented pace during the COVID-19 pandemic, और continuous training from 8 o'clock on different, चाहे वो स्टार्ट विद दी स्पिरिचुअल गीता से स्टार्ट होता हो, गीता सेशन, उसके बाद वो डॉक्टर्स की सेमिनार हो, या फिर और डिफरेंट जो है अलग अलग इंस्टीट्यूशंस के साथ हो, रात तक उनका जो है वो 9-10 बजे तक कंटिन्यू रहता था सर का। SCFI also run free daily OPD. Since the COVID-19 pandemic started, and more than 80 oxygen concentrators have been made available for free to those who needed in the Delhi NCR, particularly जो second wave 2021 में आई, उसमें सबसे बड़ा इशू था कि ऑक्सीजन कंसंट्रेटर की अवेलेबिलिटी। सर ने जो है तुरंत जो है उस हार्ट केयर फाउंडेशन फंड था उससे जो है ये ऑक्सीजन कंसंट्रेटर खरीदे, और सबको जो भी जिसको भी इमीडिएटली होता था कि आप इसको ले जाइएगा, तो ये उन्होंने इमीडिएटली किया। अनफॉर्चुनेटली उसी पैंडेमिक में सर ने हम सब लोगों का साथ छोड़ दिया, डॉक्टर के सर, और हम सबको एक यही आशीर्वाद देके गए कि सो मस्ट गो ऑन। तो आज ये सो उन्हीं के आशीर्वाद से इट इज गोइंग ऑन। SCFI also has division called SCFI Dr. K.K. Agarwal Research Fund that undertake and support research in the field of preventive healthcare, lifestyle induced illness such as diabetes, cardiac disease and concept of One Health। ये हम इस पे रेगुलर जो है एक हमारी सेमिनार वगैरह होती रहती है, अभी जुलाई में भी उनका ये होता है वन हेल्थ पे। SCFI has also fought and made a difference through several PIL difference over the years under the aegis of Dr. K.K. Agarwal, दिल्ली हाई कोर्ट में, ऑनरेबल सुप्रीम कोर्ट में उन्हें बहुत सी PIL डिफरेंट इश्यूज पे, चाहे वो एक्सीडेंट के इश्यूज हों या बहुत इश्यूज पे उन्होंने PIL जो कि खुद जाके इसमें देखा, जाके खुद ही उसमें वो डिफेंड करते थे, और उनका जो है और उनकी रिस्पेक्ट थी कि जो भी ऑनरेबल जजेस हैं उनके रिस्पेक्ट करते थे, वो खुद जाके वो है ये PIL को डिफेंड करते थे। SCFI also organized a program in the field of yoga, wellness and environment preservation, and also adopted around 200 villages to help further to cause of tree plantation। कि उस एरिया में जो अगर सराउंडिंग एरिया में जितने भी है ग्रीनरी बढ़ेगी, इवन इनका जो हमारा उनके घर के सामने जो एशियाड विलेज में जो दैट पार्क था, इट वाज वेरी वेरी बैड इन शेप, और उसको सर ने अडॉप्ट किया अपने, और उस पार्क को आज अगर आप देखें तो कितना डिफरेंट वो पार्क हो गया है दैट। और इन विलेजेस में वो जो जहाँ पे अडॉप्ट किया है, दे आर प्रोवाइडिंग, जो SCFI प्रोवाइडिंग फ्री जो है मेडिकल एक्सेस वे ऑफ हेल्थ कैंप्स एंड अदर सपोर्ट दैट। और मैं डॉक्टर के अग्रवाल के SCFI का एनवायरनमेंट डिवीजन को हेड करता हूँ, और अभी भी मैं एनवायरनमेंट इश्यूज पे रेगुलर जो है मीटिंग्स वगैरह होती हैं डिफरेंट ग्रुप्स के साथ, एक्सपर्ट ग्रुप है हमारा, और संडे को हमारी मीटिंग होती है 12 से 1, उसमें हम जो डिफरेंट इश्यूज ऑफ एनवायरनमेंट के करंट इशू, एनवायरनमेंट, क्लाइमेट चेंज, पोल्यूशन के लेते हैं, उसमें डिस्कस करते हैं, अवेयरनेस करते हैं, और फर्दर जो है पॉलिसी डिसीजंस किस तरह से गवर्नमेंट के हैं उस पर डिस्कस करके फर्दर SCFI अपना कंट्रीब्यूशन देती है। तो देयर सो मेनी, मतलब टाइम कम है, ऑलरेडी आई हैव टेकन दी टाइम, बट आई थिंक जो उनका कंट्रीब्यूशन है इस 10-15 मिनट में भी नहीं डिफाइन किया जा सकता है। तो मैं चाहूंगा कि नाउ आई हैंड ओवर टू मिस्टर रेखा अनिल कुमार, who she is a moderator of this program, कि हमारे आप फर्दर टेक अप दी शो एंड दी डॉक्टर के अग्रवाल का शो जो है इस मस्ट गो ऑन, और अच्छी तरह से मुझे उम्मीद है कि उनकी जी ब्लेसिंग के साथ इट विल गो, और हमारे दोनों स्पीकर हैं सीएल रेखा अनिल कुमार बेटे। थैंक यू सो मच।
Thank you so much, Anil sir, for enlightening us about the Dr. KK's SCFI, for taking forward the legacy of Dr. KK Agarwal with the constant efforts of Dr. Veena Agarwal ma'am and the family. Here, we are gathered here to celebrate the Doctor's Day. As we know, Doctor Day is celebrating 1st July from last 32 years in India. This day, we honor the legendary, renowned, and a great visionary, Dr. B. Chandra Roy, a great politician, a freedom fighter, and an advocate for the education. We all should remember the contribution of all the doctors working towards improving human health worldwide. They sacrifice their life and even their life and time to save the life of others who are in danger. It is important to understand the significance of Doctor's Day, as they are healing people with your warm touch and concern, along with their expertise, knowledge, and practice. You all are doing a great job by curing illness and bringing them health and happiness. I must say the world is better place because of the incredible work and contribution given by our doctors. I, behalf of SCFI, express my heartfelt gratitude from your selfless services to the nation. I'm wishing you all a very happy and healthy Doctor's Day. I would like to welcome to all my speakers and all the co-hosts of the session. For inviting our speaker, I would like to invite our legendary, very beautiful, in and out, very passionate Manju Chugani ma'am. Please come forward and welcome our speaker. Thank you so much.
Thank you. Thank you so much. And first of all, I would like to wish everyone sitting here and off the dais, on the dais, happy Doctor's Day. And we know that this day is very important. And I think it has correlation with organization of Perfect Health Mela, which was in 1993, first one. But we started working with Dr. K.K. Agarwal Saab from 1991 itself. And this Doctor's Day also started from 1991. So it has got some correlation, I feel, because he was a great doctor, and he was doctor for everyone who can afford, who cannot afford. So happy Doctor's Day once again, and remembering all activities from the beginning, 1991, when we started planning for these health melas. I was with him and I feel honored, blessed to have worked with him. And we know that global health initiatives have contributed towards the progress of protecting lives and improving the health of people globally, and significantly during COVID and for polio, for malaria, for these things. That's the global initiatives taken up have contributed. And also it's the responsibility of WHO to providing the leadership in global health matters. And the Global Health Council has taken 3 major initiatives. That's global health financing, SDGs, and global health security. So all doctors are contributing towards these 3 initiatives which Global Health Council have taken. So I feel that we Indians are very, very lucky to have so many doctors from different fields and are working tirelessly. I must say, if you go to any other country, they have definite timings, they have this, that, so many things. But here, whenever there is a patient, there is a doctor available. So I feel that on this day, we must applaud all doctors of India enormously. And improving human health, they sacrifice a lot during this. And this year, Doctors' Day theme is very appropriate and very apt, celebrating resilience and healing hands. So the hands which I'm saying from the beginning, and resilience which they have showcased is very well during COVID. Everyone is privy to that and witness to that. So coming back to the topic, that is health initiatives, global health initiatives, and doctors' role and strengthening health for all, on which we are going to hear from our 2 experts sitting here from the beginning itself. And that also shows their commitment and solidarity towards the health of people. And that is what I was appreciating since the beginning, that they have joined before us, actually. So thank you so much for that. Let me introduce first Dr. Nishinath Jha, who is MD in medicine, and he is a senior consultant physician, Fortis Hospital, Shalimar Bagh, and also a director of Good Health Clinic, Shastri Nagar, and he is also General Secretary, North Delhi Physicians Forum, and he is so humble that he has not given a lengthy CV of his or his work, but he has given a very short CV, but we can make out that his contributions towards mankind. So welcome to this webinar, sir. Thank you so much for joining. We can give big round of applause to him. I'm sure that we all are going to get benefited from his work and his guidance. Thank you. Coming back to our one more eminent and renowned speaker, Dr. Ellen Gupta, professor and HOD, ESIC Medical College, Faridabad. He was formerly working as professor and HOD neurosurgery, Dr. RML Hospital, and he did his MBBS in 1978, way back in 1978, and PG in surgery in 1983 from KGMU, none other than KGMU. It's a royal college. Building still looks like a majestic and royal buildings. So he is from that institute. So you can understand that what knowledge and what the treasure he is having. And he is a proud recipient of Singapore Colombo Plan and WHO Sydney Fellowship, associated with National Trauma Center program of GOI. And also he has contributed a lot during COVID and during other programs towards society. And we are really honored to have you all here. I didn't wanted to, I opened today's newspaper and I thought first page will be on Doctors' Day, something which media has to take up as a very, very important thing, not only the paid ones, but on these days, if any of the politicians, but I would definitely make it a point that take this point to those who matters or who influence to next year to publish it as a doctor's contribution, Doctor's Day, first page of the newspaper, so that everyone knows that today is Doctor's Day. It's very important day. That is why I was thinking, I opened first the newspaper before sitting on this forum. So it was not there, and we have to make sure that this, through this Heartcare Foundation also, we put forward this point that Doctor's Day should be celebrated very well, and globally it is being celebrated. Why not in India when doctors are available all the time? I'm saying repeatedly because I have seen other countries how difficult it is to reach to doctor and how costly it is. In India it's not so. So we must appreciate and put it on records that yes, we acknowledge and we feel honored to have doctors in this country like that. Not taking much time, going
sorry,
to
ma'am.
my
Manju ma'am, I'm
next
sorry. Manju ma'am, I'm sorry. I just want to. I'm sorry, ma'am. Ma'am, today is Dr. Ellen Gupta's birthday also.
Oh,
yeah, please.
We can celebrate that also. That's also a wonderful coincidence. I must say that he was born to be a doctor. Happy birthday to you,
absolutely,
sir.
Ma'am.
Yeah. And we have another co-host with me, very renowned person again, Dr. Geeta Parwanda. She is working as professor, principal, and dean of Subharti College of Nursing University, Subharti University, and she has more than 3 decades experience in research, academics, education, and administration. And she has a lot of publications, attended national international conferences. She has, to her credit, lot of best teacher award, best principal, best education award, and there are a lot of best. I was reading about her, and I'm not taking all today into this, but I understand that Star of Asia award also she got. And it's a long list, which I feel today we all are waiting for 2 of our eminent speakers. I'm not spending much time in that, but she is a leader in nursing education, nursing administration, nursing research, and is a very strong source of inspiration for many budding nurses and for juniors. So with these words, I would like to welcome our Geeta Parwanda ji to this webinar to carry forward the program. Thank you.
Yeah, Jai Hind and greetings and very, very wishing all of them a very happy Doctor's Day. And I'm so thankful to the platform of Heart Care Foundation of India that was given the opportunity to be as a team member. And hereby I welcome Dr. Anil Kumar sir, Dr. Nishikant Jaji and Dr. Ellen Gupta sir to please we know that you are the role model and the leader in the doctors community, and today our nation's strength is because of the health of our country. And so without wasting our time that and today first of all I'm so thankful to late Dr. Agarwal sir that who was always there not only in the COVID time, but from there we started this profession of healthcare that always sir motivation word मैं हूँ हाँ और आपको कोई प्रॉब्लम हो तो मुझे कभी भी कांटेक्ट करो कॉल करो और अपने बडिंग नर्सिंग स्टूडेंट को ऐसी फील होने दो जो उन्होंने मेला शुरू किया था सीपीआर का जो एक मास एक्टिविटी शुरू करी थी आज हम सर को याद करते हुए हमें लग रहा है उनकी कमी तो महसूस हो रही है बट सर ने हमें ऐसा जुनून हमारे मन में डाला कि आज सर जो आपकी आवाज थी हम सब एक टीम बन के हम साथ जुड़ेंगे जय हिंद and over to you Dr. Manju Chugani ma'am to please call upon Dr. Jha sir for giving their valuable message on this auspicious day.
So over to Dr. Jha. Thank you.
Thank you very much. First of all, I must thank Heart Care Foundation of India. And all organizers, Dr. Anil Kumar, Dr. Geeta, for giving this opportunity to say a few words. In the very beginning, I want to say, जैसे Dr. Ellen Gupta birthday share करते with the Dr. B.C. Roy, I have also got something common with him. Dr. B.C. Roy was born in Bihar. I am also from Bihar. So that is common between me, Dr. B.C. Roy and Dr. K.K. Agarwal, tremendous man. मैं तुमको महामानव बोलता हूँ. इतनी सारी चीजें करती थी. हमारे एसोसिएशन बहुत ज्यादा तो नहीं रही, but there was a time एक साल ऐसा था. He was the vice IMA president, national president of the Indian Medical Association. I was the president of the branch of Delhi, North Zone. So we had some interactions, and on the same day, on that year, we had a blood donation camp, and he was one of the dignitaries, and he came. Make it point to come. So he was a Mahamadav. क्या करते थे कुछ पता नहीं. And one photograph of his or video of his is very, very touching. And the last days of his life, he was with the oxygen on. He was seeing the patient. I think that was tremendous, and that shows, speaks everything about him. What a person of man he was. So today, I think I will share the screen first.
Sapna, do we have sir's presentation? If we have, and it's
I don't allude to that.
okay. Okay.
I will share the question.
Yeah.
Okay. So today's theme is role of doctors. I mean, doctors should not be there because doctors' day, so that's why we say doctors' day. Otherwise, doctors, nurses, and all the support staff, they are part of this global health initiative. And finally, in respect to the strengthening of the healthcare for all. That is the today's topic. So initially, I'll say a few words about for the global health initiative. There's a big contribution towards the protecting lives that we do, treat the patients and save their lives, and improve the health of the people all over the world. That is globally. That also includes in a big way about the individual diseases like HIV is almost HIV and AIDS almost under control. Polio in India it is eradicated and is on the eradication in the whole world. Malaria eradication is on a very advanced stage. tuberculosis, I think we are going to get good news in the near future. And of course, vaccine coverage all over the world. And that we have seen during COVID, the COVID vaccine we have distributed to all over the world. So these are the big contribution of this global health initiatives. There are 9 global health initiatives we have got. And AIDS, tuberculosis, and malaria management, we all know it's all going to be eradicated gradually. Immunization, yani vaccines, has to be given to all, and that to reach to the remotest corner of the world. So that is globally, that is one of the initiatives. Maternal to child age, that is reducing the maternal death, morbidity, or perinatal death or mortality. Then tobacco, we all know, is a very bad substance which can cause even coronary artery disease, mouth cancers, lung cancer, and mouth cancer. This all can do. So we should avoid and educate about the what are the bad effects of tobacco use. Then proper utilization of human resources and procuring human resources, because human resources are the very, very important for managing any health initiatives. The new diseases also come up. Recently, about 3 years back, we had COVID pandemic, and we have to do a lot of things, and we did very nicely. Then some different strains of Japanese encephalitis, the wider diseases are coming in the UP and other places. So these are all the diseases that should be taken care of. Nutrition earlier used to have a big, but still in some parts of the country there's always malnutrition. So that has to be also taken care of. And health promotion, that is with the advertisements by the mouth, by the doctors, by the nursing staff, by the support staff, by the media, by the papers, everywhere we have to do with the TV and all this is one has to do for the health promotion. That is one of the initiatives. And finally, which I am going to talk about, the health system strengthening. So health system strengthening will be my main focus. How to improve it. So this is the news we had, those slightly louder, but this types of problems can be everywhere, that hospital is charging more, doctor is not taking care, doctor is beaten. So those things coming very commonly these days and very sensitive in the news. So who are part of the healthcare system which has to be strengthened? One is, of course, stakeholders, public, because they are recipient of this system, but they are part of this also health system, because screening, other things. Sanitary members, all they have to take the different hospitals, government hospitals, private hospitals, that includes corporate as well as nursing homes and the clinics, medical fraternity. Mostly it is doctors, nursing staffs, and the support staffs are there, AYA, ward boys also. Then of course media, one of the biggest culprit in our healthcare system, and judiciary, I cannot say culprit because they are respective societies, but they are also part of the some problem. So who is responsible for this? Do you think this problem is the management of the hospital or the management of the country? It's problems of doctors, it's problem of the patients, or problems of attendance. So this is not the problem. So problems of the nursing care or staff. So there's a big no. They are not the reasons. So the big no, they are not the problem, part of the problem. So what is the problem then? But is due to the lack of proper knowledge. Proper knowledge is, of course, very important part, a very big part. But coordination among the healthcare providers, public, and the government is very, very important. That coordination is lacking in our country. My lecture will be on the most part of the country. Then, because of the lot of accidents happening, we have seen in the different slides, there's unseen fear in the mind of the doctors or the healthcare staff that I might be abused, I might be beaten, I might be this thing. harmed. So these things, so that unseen fear is there. I tell you, we are from the personal experience. Emergency our two. First part is that we see the patient's condition, how it is. A second assessment is being done that what is attendance attitude, whether it's proper attitude, whether it's a hostile attitude, what profession he is, some problem. So that is the second point. That is very important part, which is not good because they have to look after and give the full care to the patients only. What is the problem of the treatment? This is this thing, but this is part of the thing because of the unseen fear we have seen, and we have faced also. All the doctors have faced some sort of abuse. How this can be improved? Updating knowledge, this is happening that we are doing CMEs and all workshops, everything, doctors, nurses, staff, all they do frequent training and so on. And coordination is also required, which is that's not coordination from the healthcare staff, it is from the government and all the administrative part also. So by coming out of the self of unseen fear, so if we have got this coordination, I think that fear, if it is removed, then we can do the better and give the better services. That is very important. And apne yahan, you say everybody is knowledgeable, everybody is doctor. When it is some uneducated, everybody is doctor. But यहाँ पे ज्ञान ना बांटे. But my take is different. But should always update ourselves. जहाँ से भी मिले, whatever source you get the information, you must take it. And then take it. If you feel comfortable, if you see right, you must take the knowledge. Then what other problems was that we have seen just example like being the COVID-19 pandemic. We have seen that bureaucrats and officers, they are running the show better, but they were not accountable. Every day they have TV briefing about the disease, what is to be done, what are the guidelines, but they were not accountable. So medicals were not very, they were managing the show, bureaucrats and officers managing the show without the zero knowledge, with no accountability. So that was, so medical fraternity was very upset about this thing because they were dominated by the non-medicals and they were running the shows and we had a very little in our hands. And the main reason for the shutdown ultimately create because of the deficiencies in our healthcare system, they create a breach of trust among the doctors, patients, and their attendants, and society as well. So that is these days we say people want 5-star treatment, but they don't want to pay. They want free or the charitable rates, or with the help of the politicians or the netas, these things they can sing. So 5-star facility with no payment or with less payment is the theme of these treatment, which is not possible. If they don't get this thing, then they are treated and the charges are exorbitant or maybe high charges. They assault the doctors, especially the resident doctors, they are available most of the time and they can damage the hospital property also and the staffs also being beaten. So this is very common these days because of this business. The first slide I was very comfortable. The balance is there. Both the work together with the miscreants, Italians, they do something. He's also going to die. So that has to be taken care of. Then what are the sufferers of violence? Only doctors, patients, and their attendants, along with the taxpayers. Taxpayers because all the hospitals, government hospitals, are being built with the money of the taxpayers. So doctors, patients, their attendants, and other patients also being inflicted when it is suffer the violence. When there is breach of trust among doctors, patients, and attendants, so there's a breach of trust is there in the last about since the time this Consumer Protection Act has come, or now this CA is coming. So there's a bit of lack of trust among the stakeholder, doctors, patient, and their attendants. So what are the reasons? There's a few of the reasons, not all reasons. Consider pathy selection. The preferred pathy is allopathic, Ayurvedic, homeopathic, Unani, all the rest there. Cross-pathy is a big problem. Mixopathy, not coming of the age, and the government I think also approved about the mixopathy that Ayurvedic can practice allopathy also, or homeopathic can also practice allopathic also. How they will do it? Like I'm an allopathic doctor, how can I treat homeopathic with the homeopathic drug? How can I treat unless I'm trained in that? But somehow government is doing it. Let us see what is the final draft comes and how is successful or not. Then big problem about the bills. So by the time you get the bill, things change. When they see the bill, every bonhomie changes. So that is one thing about the bills. I can tell you one normally story is going among the medical doctors. The patient is admitted in the ICU in a very sick condition. That time doctor is a god. If you say हम भगवान नहीं हम तो इंसान है बोला नहीं डॉक्टर साहब आप ही गॉड हो गॉड तो गॉड को बताती हो सेकेंड डे थोड़ा ठीक हुआ तो डॉक्टर साहब इज लाइक एनी डॉक्टर डॉक्टर साहब कैसी तबीयत है ठीक है थर्ड डे डॉक्टर साहब शिफ्ट का पैसे बना रहा है फोर्थ डे जाके वो
I'm sorry, sir, you have to wind up because time is too short. We can love to hear you, but there is a time limitation.
Okay, thank you. The misstanding of the doctors. Who is responsible for this? Government is there, media is there, judiciary is there. Government, the framing interest of various docs, protocols, guidelines, rules, and delivery consultation of bureaucrats, non-medical. Doctors are very rarely involved in all the guidelines. Different organizations, government hospitals, they have their own products, they are not well equipped and lack of staff is recording in primitive state. And machines and everything is not working, being purchased also, but they are not being opened up because there are no person to run those machines and this thing, adequate staff is there. So these are the problems in the government hospitals. Private hospitals, rules and regulations very high. They are taking high-tech equipment and main quality of services also suffers if they are not able to manage the high cost of the treatment. Then all the staff, exception other staffs are all also. So once what is the requirement of the patient? The one has to have well equipped high technical hospital, but charges be low, which is not possible to deliver. That's why doctors are the face of the hospital. So always say doctor bड़ी लुटे हैं या doctors staff बड़े लुटे हैं. That is one thing. And ये ज़्यादा फ्री करने का ये चेक करो तो एक कंबल को 10 आदमी मिलके बांट रहे हैं. ये बेचारे ठंड से मरे ना मरे ये ऑब्लिगेशन से जो मर जाएगा. कॉस्ट कटिंग से समस्टर इक्विपमेंट जो स्टाफ हो जाते हैं. inadequate trained and staff मिल जाते हैं at all the levels. The commission gaps are there. There are ethics, various ethics, and law always they also confused. Law is binding on us to observe. There are various ethics committees, National Medical Commission, Medical Council of India, State Medical Council of India, and for opening any medical center or the nursing home, you have the loss of license and statute of research there. One has to take about 72 clearance for opening a shop, which creates a Babu Raj with lot of corruption, and chances of medical errors are very high because of a lot of rules and regulations are there. So leads to the assault and always sort of the doctors because they're the face of the Indian medical system. Justice also said there are 70 laws to open a medical center. It's always questionable. So because of the overt low, not many law regulations, with efficient burden that is at the personal level, with broken relationships, alcohol, substance use, depression, suicide. At the level of professionals, the decreased quality of care, increase the medical illness, decreased patient satisfaction because always overburdened and is not satisfied, decreased productivity, personal effort, and efficient turnover is less, not less number of people are coming to the profession. So what is the medical reason? There is no behavior, how should I change my behaviors? Then there was a bill for the protection of balancing and doctors that was rejected by the Ministry of Home. Media is one of the biggest culprit with a lot of stories going on. They create sensationalized because the TRPs, they don't know the facts, they don't take the facts, but they sensationalize it. So giving doctors in a very, and the hospitals and all the staff in a very bad light. Movies, we all know doctor is always portrayed as a joker, or as somebody who is a money hungry. He निकालो तो आपका इलाज होगा, नहीं तो नहीं होगा. So although you can see cervical cancer is for the ladies, as in the cervical, the cervical vertebra is found. So lack of knowledge and not very responsible. How does it improve? We should stop media movie makers from making fun of the doctors or making issues which are not correct and making mockery of our profession. And on real facts also the all associations, National Medical Council, Medical Association, and said they also take legal action against any wrongdoings or breaching trust. Government, doctors, public, they are a very teamwork is there. You can see these three can be managed. So this is a teamwork is very important. So what is the take home message? One has to change attitude towards the doctors, hospitals, or the support staff, nursing officers. Teamwork with every resources, whatever resources there is not always perfect. And combination skill development with special emphasis in vulnerable areas like casualty and intensive care, where the lot of crowded occurs. That is one thing. That is for the doctors, young doctors, nursing staffs, and all the support staff. That special training has to be there. So with this, I conclude my talk. Thank you for attending for participating.
Thank you so much, sir. I'm sorry I have to stop in between because there is a shortage of time.
I
We
know.
definitely call you again for this detailed session in future, definitely.
No, but thank you. Thank
It's our honor to be you have here. Now, I just want to invite Manju ma'am, please welcome Dr. Gupta, sir. And I just, I'm sorry in between. Because sir has already covered the topic, I just want to give a topic to sir. What will be your vision and message from the young budding doctors for the strengthening healthcare for all? Over to Manju ma'am, then Gupta sir.
Oh, it's already done. Thank you so much. And thank you, Dr. Jha, for last line, change attitude, teamwork with resources. Thank you so much. And I think we will not waste time. Over to Dr. Gupta. Thank you.
Shall I repeat your question, sir? What will be your vision and message from the young budding doctors for strengthening healthcare system? Over to you, sir.
आप म्यूट है, you are muted. Gupta?
Sir, you are mute. Sir, please unmute yourself.
Yes, now it is audible.
Yes, yes,
Yes.
very much.
So I pay my sincere Shraddhanjali to our beloved Dr. K.K. Agarwal. Happy Doctor's Day to all my colleagues and you all nursing faculty sitting here and all nursing faculty who work with step by step with ourselves. So whatever had said by Dr. Jha is very reliable, but outside I want to convey that the health strengthening system is a unified channel. It should be a unified channel. It should be a effective, efficacy, sustainable, and equity in all sections of the society. Okay, so healthcare does not mean only treatment of the diseases. Healthcare means their physical and mental well-being also. And to this, I will add social well-being also. Nowadays, whatever we are noticing, seeing, so it is a physical, mental, and social well-being. And whenever we talk about the healthcare system, it includes the health promotion, health, which should be health maintenance, health prevention of disease, preventive aspect and treatment of disease, and then rehabilitation. So as far as the promotion health is concerned, there is no specific pathy doctors can do it. Any pathy doctor can do it. And this promotion of the health includes the diet, how your behavior, how you do physical exercise, you do some yoga exercise. By this, all this, we can promote the, as a doctor, we should have, train the public, general public, to promote the health. Then comes the maintenance, and this should be maintained. And this should not only be the treatment of the disease. Nowadays, technology have come, new technology is available, disease can be controlled, treated. But I will like to say that doctor, whether it is a general physician, whether it is a specialist doctor, whether it is a specialist doctor, each can do or contribute in the field of healthcare. I think there should be coordination between all categories of doctors. First, as a general physician, what happens? He should have knowledge of the emergency medicine. He should have whatever patient has come, not just like to referring to higher centers. He should be able to manage all the emergency, whether it is cardiac emergencies, whether it is a neurological emergencies, whether it is any other system emergencies. So emergency knowledge. So what we see nowadays, most of the doctors are lacking in leadership and management qualities. That have to be improved in doctors. They have to be leaders also now. And health promotion, they can organize camp, they can go to school colleges, doctors can go to residential welfare colonies, workplaces, and train the public to promote the health. So one role of the doctors is promotion of the health. So he can go to every place, workplace, residential welfare association colonies, and school colleges. School colleges best option to target. They will teach their parents also. Then we especially the doctor, whosoever patient reaches, there should be collaboration between the public and private sector. It is a very need of ours. It's not like if patient don't have any paying capacity, then he will be immediately transferred to government hospital, and on the way patient can deteriorate. I think every patient has right to health. Every patient, he should not be denied any chance of promotion. Whatever emergency management knowledge doctor has, I think NMC is doing that. Doctors should have emergency medicine training, computer training, and leadership training, management training. So patients should be managed. Whosoever is present, whether it is a general physician, it is a neurosurgeon, or it is a surgeon or pathologist, whosoever is present on the site of the, when patient comes, he should manage the patient first. And then immediately we can call the concerned specialty doctor. So that is the best way. Doctors should not wait till this specialized doctor will come and start treatment. Second, as a doctor, we should convey doctors that the MLC cases, the formalities, medical legal formalities, insurance formalities should not come in the way of treatment. Patients should get treatment immediately after coming to hospital. We should not wait till the admission jab bhi milega, then the all formalities will be completed. So as a doctor, we should give message to these insurance companies, the police department. As a neurosurgeon, I can say that we have made a policy that police will not परेशान किसी को नहीं करेगी, because treatment can be started. Police will not ask any question from the public, whosoever has helped the patient to brought here. Then, as a neurosurgeon, I can say health promotion, that we should make data of every illness, diseases. And unless until we give data to these bureaucrats or government policy making, we cannot get any upgradation of the system. So we should regularly prepare data, and we should forward to bureaucrats, policy makers, so that they can take necessary action in the future. Will make policy accordingly, release fund accordingly, so that will improve the health system further. Second thing, then it comes like we should collaborate with the industries, road transport system, automobile industry, other industries, food industries. Doctors should be included in policy making like this. And different doctors associations like Cardiology Association, Neurological Association, other societies should come forward and collaborate with the industries. Like as a Neurological Society of India, we have forwarded to automobile industry that they should not launch a low-cost vehicle without proper safety measures. They should not launch. Similarly, Cardiology Association can motivate the industry, food industry. The food should be at to up to the a standard level. It should not have any mixture or any adulteration. So quality should be there. Person should know how much fat he is consuming, how much carbohydrate he is consuming. There is true and packed food, but even open shops, we don't know. Nobody knows. Imarti, jalebi, how much fat you are consuming, how much carbohydrate you are consuming. So that is the problem. As a doctor, we can collaborate all the industries and policy makings. Then third role comes the maintenance. Maintenance is more important. Maintenance is health maintenance is very much important. We should teach the public. We should go to school, college, organize the camp, find out, identify the person who are malnutrition is there, anemic there, calcium lacking is there at the school age, thyroid deficiencies are there. So by the time patient grows, they become mentally weak, anemic, weakness. So I think that we should target at the school level. So identify the health deficiency and correct it at that level. Then comes the prevention, disease, prevention of disease. A prevention of disease like, for example, road traffic accident. As a neurosurgeon, I can know. It may be a man-made defect. It may be a defect in road and lights are not proper, roads are not properly built, vehicle is not in good qualities. The person is using alcohol, person is busy in mobile phone. So all this should be legislation should be made and high fines should be imposed on these persons. They are risk to themselves, they are risk to other person also. So that has to be, as a doctor, we can go to policy making and bureaucrats, right? Then comes the treatment of disease. Treatment of disease, I know now younger generation, they are using more and more advanced technology in the field and results are very good. But then if you find out after emergency resuscitation, patient needs neurosurgical help, then refer to neurosurgical help along with in the ambulance, proper ambulance, and then with all life-saving equipment with the patient, then no problem will arise. Whatever problem, day-to-day problem of doctors you have highlighted, I fully agree, whatever is happening nowadays. But then comes the communication, proper communication with the patient's relatives. I have noticed that if you communicate patient's relatives properly, every time tell the condition of the patient, what is our plan, what you are going to do, what you can achieve. Don't give false belief that your patient will be all right. These problems usually arises when we don't communicate properly with the patient. And they are in the impression that our patient will be 100% okay. And the results are not encouraging, then what happens? Then they react. Then comes the social well-being. Now it is a very important question nowadays. Every person has to be socially well-being also. At workplace, how do you behave with your colleagues? How to talk to your colleagues? How do you talk in your society? That has become very important, and because we are not giving any proper attention, that's why these problems are arising daily. We see quarrel, hinsa, jhagada, or katleam, everything. So people's behavior need to be changed. So as a doctor, we can organize camp, we can do awareness program. I have carried out certain head injury
I'm
prevention
sorry, sir, time, we have a
program.
constraint in
Yeah.
time, sir, please.
Right, you are right. So these were the important. As a doctor, we can contribute to society in every aspect, not only treating the disease, but health promotion, health sustainable rehabilitation. Post that patient thinks, okay, I have now cured, nothing will happen to me. But as a doctor, you are all right. We have saved your life. God has saved your life, but you have to take precaution in the future so that this disease does not appear again and again. And good rehabilitation so that patient can become useful to society, to family, everywhere. So as a doctor, we have lot of at every level. No doctor is less than any super specialist. Even we need basic doctors in the country. Actually, pucha jaye to I will say that we need who can save the life of the patient. We don't need much super specialist. Super specialist to baad mein aati hai. When life is saved, only then treatment can be carried out. So doctor can play a role at any level: school, college, society, family, rehabilitation, health promotion, health prevention aspect, give data, communicate to government, policy making, give them correct figures so that policy maker can, unless until we project our figures, our data to these policy maker or government, they will not take attention, proper attention, how much budget is required, what policy should be making. And so these are the, I think, Mrs. Rekha is saying that I have to stop. There is no time later, but
I'm
this
sorry,
topic-
sir, because we're already exceeding the time, and we
but I
definitely
think
call
health-
both of you
but I think-
then a next session very soon,
Yeah,
sir.
but the health system strengthening should be a unified and continuous process. I think so.
Exactly, sir, exactly. I'm very humble कि आपने आकर अपना टाइम निकाला और अपना important जो thoughts आप जो practice को share किया. I'm really thankful to Dr. Jha and Dr. Gupta. I just in the between I just missed to call our co-host and introduce them. Mrs. Archana Chaudhary, Principal School of Nursing, Tirathram Shah Hospital. Dr. Manisha Gupta, Principal Rabindranath Tagore University. Ms. Sakshi Singh, Assistant Professor, Holy Family College of Nursing. Ma'am, please come one by one and take your 2 or 3 minutes to share your thoughts. Archana Chaudhary, ma'am, please. Archana Chaudhary, ma'am, are you there? Dr. Manisha Gupta, ma'am. Dr. Manisha Gupta, ma'am.
Hello.
Yeah, please.
Okay. Good morning, one and all present here. First of all, I would like to congratulate to all the doctors and wish you happy Doctors' Day. I am Dr. Manisha Gupta, Principal and Dean, Rabindranath Tagore University. We are having a pleasure to be Dr. Anil Kumar sir to be here for the celebration of this big day. And Dr. Nishinath Jha sir from the MD Medicine Fortis Hospital. So I'm very much thankful to be here, sir. And you have shared a lot of things which you have faced during this your service period or with the patient. And I am also, when I was in clinical practice, I also saw so many patients are shouting over the doctors and fighting with the doctors, and when they are in crisis they are always say ki doctors is a precious gift of the god, and they are always remembering ki sir hame bacha lijiye and we are in problem. So that's why, so really it's a very good gift from the god. When you are here, then the patients and people, those who are suffering, they will be relaxed. So happy Doctors' Day, sir. And I am very much thankful to the Dr. Mrs. Rekha Anil Kumar ma'am for organizing this webinar on this precious occasion. And I am very much thankful to the Manju ma'am. So ma'am has introduced very much in this coordinating this webinar. And our co-host Archana ma'am and Geeta ma'am is also being here. And Jha sir has said about the global health initiatives. That is very much important. Now there are so many problems arising like AIDS, malaria, tuberculosis, immunization. During the COVID time also it's being erupted new diseases. So time by time we have taken, doctors has taken the initiatives, and healthcare persons also being there to resolve these problems. So thank you so much, sir. And sir has also highlighted so many things. Anil sir has highlighting. We have raised the voice to decrease this type of issues regarding the fighting conflicts and injuries over the doctor. So thank you so much, sir, from my side on
Thank
the
you,
behalf
Manisha,
of
ma'am.
Rabindranath Tagore.
Thank you, Manisha ma'am. Thank you so much. I would like to invite Archana Chaudhary ma'am or Sakshi Singh ma'am if they are available here. Sakshi Singh ma'am, are you there? If no one is there, then I just want to invite Dr. Geeta Prabandha ma'am. Please come forward for the final remark and vote of thanks. Over to you, Geeta.
Thank you so much, Professor Anil. First of all, I'm thankful to Almighty to be on this platform and on this team on this auspicious day of Happy Doctors' Day, 1st July 2023. And Today, the theme of this program was Role of Doctors in Global Health. As we know that physicians, doctors play in caring for our community, we value the insight on the community healthcare needs, their honesty, commitment to improve the health and well-being of all we serve. Our doctors always give our people amazing gift by conducting deliveries, helping children to grow healthy, and even healing wounds, providing them all hopes with all age. So they are as healer, counselor, and thank you all once again for all willingness to be the world good Samaritans. We are thankful to Dr. Anil Kumar sir, who is the director of Healthcare Foundation of India, for mentoring and mentioning the normal philosophy of Healthcare Foundation with their objectives and activities focusing on prevention of disease. We also extend our thanks to Dr. Nishikant Jha sir, who is working as a senior consultant in Fortis Hospital, for briefing the role of doctor in the community and about the ethical consideration and the professional legal decision. Sir has also mentioned the regulation list and about the regulatory body as Medical Council of India. We are extending our thanks to Dr. Ellen Gupta sir, who is a neurosurgeon, and sir has mentioned his thought-provoking about the decision-making skills in critical care, and sir also mentioned about the social well-being, which is a very important aspect to strengthen our nation. To conclude, we thanks to the platform of Heart Care Foundation, the organizer, and the moderator, Professor Rekha, and my co-host, Professor Manju Chugani Madam, and Mrs. Manisha, and Mrs. Sakshi, and I am again thankful to all who have been the part of for remembering and organizing this National Doctors Day. Thank you so much, and Jai Hind.
Thank you.
Thank you so much, Geeta
Thank
ma'am.
you very much.
Thank you
What's your message to all the young Virat Kohlis watching this and young Jemima Rodriguez is watching this, who will take the country further?
I'm so glad you used the second name. I think when I watch the women's league, it's like watching a new emerging kind of activity.
Vikings would always invade with the women as well.
Okay, all right.
We need to be Vikings now.
You notice I'm not disputing it. So,
why are you doing this podcast?
I'm doing this podcast, one, because I like you.
That's right, ladies and gentlemen. This is Dr. Jaishankar, the Minister of External Affairs on TRS. Possibly the most requested episode we've had in the longest time, because we've done so much geopolitical content and this legend has come up so much on the show that we just had to bring him on TRS. Keep in mind, this is a very short episode. There was a time constraint because of schedules on that particular day. So I couldn't podcast exactly the way I wanted to with Dr. Jaishankar, but it's a beginning. You're going to see an incredible episode of TRS up ahead. Special thanks to MyGov India for making this happen. This is my mid-20s dream to talk to this man, considering how much he's done for the country, considering how he's rewritten the country's branding on a global stage. This was a great icebreaker with the legend. As I said earlier, I was a little nervous to speak to the cabinet ministers, but Dr. Jaishankar made me feel extremely comfortable. That's his actual real life vibe if you're a young, motivated Indian. And that's what this particular